diagnosed. I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jansen and Mr. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusin, Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. First of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPAR, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer, and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient yung Simply Nature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Hispano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed Webinar. This program is proudly brought to you through the collaborative efforts of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. As an international leader in wellness, Simply Nature specializes in high-quality supplements sourced from a unique strain of microalgae known as PPARs. This research-backed nutritional approach is widely recognized for its ability to support cancer patients, boost immune function, and improve metabolic health. It is particularly effective for those looking to naturally manage blood sugar, blood pressure, and cholesterol levels. Once again, good evening and a very warm welcome to all of you. It is truly special to have you here today, especially as we are right in the heart of International Women's Month. This is a time dedicated to celebrating the strength, resilience, and health of women worldwide. In honor of that, we've designed today's session to be a tribute to your vitality. We're here to dive into a topic that is as complex as it's vital, the estrogen equation. For many of us, the word estrogen carries a lot of weight. It's a life-sustaining hormone, but when the balance shifts or when we're navigating a post-diagnosis world, it can feel like a source of uncertainty. Today, we're breaking down the two pillars of long-term wellness, the reducing recurrence and strengthening cellular integrity. So for our first pillar, solving the metabolic equation, it's not just about how much estrogen you have, but the pathway it takes. Think of your body like a traffic system. We want estrogen moving down the protective 2OH route, not the reactive 16 alpha 1. This is where Simply Nature PPARs acts as master switch. By activating your PPAR receptors, it essentially upgrades your cellular operating system to ensure hormones are metabolized and cleared efficiently. For our second pillar, the cellular fortification. In honor of Women's Month, we are focusing on fortifications. Your cells need a spark to repair DNA and reduce inflammation. Simply Nature PPARs serves as a gene activator, telling your cells to stay robust and resilient. We want to make your internal environment so electron rich and healthy that it becomes inhospitable to recurrence. For our dearest cancer warriors out there, you may be a warrior by choice, survivor by grace, but please know that we are all proud of you. This session is for you, so let's make it interactive. Hormonal health and gene activations are big topics. Please drop your questions about the equation or Simply Nature into the comment section. We'll address as many as possible during our dedicated segment. So once again, let's honor International Women's Month by investing in our cellular future. Let's solve the estrogen equation together. Now, the intention, once again, of this webinar is to make sure we answer more questions to empower you even more in your journey. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion are highly respected health experts. First up, it's a pleasure to introduce Dr. Jansen Kalalan, alumnus of St. Luke's College of Medicine's. Dr. Kalalan is a distinguished diplomat of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He currently serves as a consultant specializing in integrative oncology across several premier institutions, including Alta Integrative Medicine and Wellness Complex, a Perpetual Health Medical Center, Las Piñas, Tree of Life Medical Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Next is he will be joined by a Singaporean-based PPARS expert, and as a visionary CEO behind Simply Nature International, he combines his entrepreneurial success with years of international speaking experience to share deep insights on how health serves as the foundation for true success. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan. Good evening, Doc Jansen.
Good evening, Sheila. Good evening, Doc Jansen.
Hello, good evening. Hello.
Good evening to everyone too.
Good to have you both tonight. Both are present. All right. For our first question for today, okay, coming from Miss Ina, my mother is a patient of breast cancer, and she is already 96 years old.
Oh, wow.
It already has metastasis on the right side of her chest, and she is also bedridden. She is only taking in or eating 1 to 2 tablespoons at the moment. And she is also given chemotherapy, oral chemotherapy. So what is the best recommendation for my mom?
Wow.
At this point, you listen to her.
Yep. I want to say this too. Doc Jansen gave the perfect answer. Just ask your mom what she wants, right? Yeah. So Doc, maybe I ask Doc a question to help the listener understand why I think uh I'll ask Doc a question which hopefully will help the listener understand and maybe make some decisions. Doc, why what compels or what governs oncologist, right? And I'm sure you can speak on their behalf, right? When they have a 96-year-old patient, um, why do they why would they still prescribe medical protocols? What's the thing that doctors learn and yeah, why is the doctor still treating with, for example, chemotherapy? I'm sure there's like a good principle that they are following, right?
Mhm, mhm. Well, they're trying to extend the life of the patient. So
Mm,
with the use of medications, you can slow down the spread of the cancer, even if it is stage 4 already. You can slow it
mm,
down. So, um, for a person like for a for a 96-year-old lady, I mean, if the medication can extend her life for a few more
mm.
months, why not, right? If she can
So
spend more time with her family.
So if the family doesn't say something, so I want to ask this question also. So in general, for doctors, would they? I'm guessing, right? I'm not guessing. I think this was in my medical ethics program as well as an interesting topic. Doctors in general would not suggest not to treat the patient, right? As long as there is a treatment option. They in general, I don't think doctors in general would say don't do anything and prepare for the next phase in life. I think it's in a doctor's professionalism and their ethics to at least recommend protocols. Is that something that drives a doctor? I mean, I've never seen a doctor say, "Ayah, your mom is too old, lah, no need to treat." uh, I don't think doctors are like that. But also, I think for many doctors, not many doctors would actually recommend something along the line as not to treat a patient. Is that something that actually compels doctors in general, or is that something that is taught to doctors that they should always if it's possible, recommend protocols and not say do nothing. Yeah.
Yeah. So this is where so this concept is called shared or shared informed or informed shared decision making.
Mm,
Okay. So this is when we as doctors we have to guide the patient, the family, and the patient to decide
mm,
which path to go for.
mm,
So with this guidance, we have to offer options,
mm,
um, things that we can do for
mm.
the patient.
Yeah.
And with the things that we offer, we have to weigh the pros and cons
Mm,
because it doesn't mean that you can do it. You have to do it. Okay. So, there lies the shared decision making between the family, the patient, and the health professionals.
mm.
So, for this so let's go back to the question, to the
Yeah.
example, no?
Correct.
96-year-old patient.
Mm,
96-year-old patient, stage 4 cancer, 96 years old, bedridden, not eating so much. Would if we go for the guidelines, okay, follow
mm.
the guidelines, the treatment is chemotherapy.
Yeah.
Would you give chemotherapy to a 96-year-old patient? Come on.
Yeah.
Would
So
that
doc,
be acceptable? Yeah.
Mm. So there are guidelines that doctors will fall back to. So the guideline is to prescribe chemotherapy. But Dr. Johnson, Dr. Ami was here for an oncologist conference, and she actually brought me to a palliative center in Singapore. So it was, as a Singaporean, it's my first time at a palliative center. So it was very interesting because I used to think that when you go for palliative care, it's like end of life. Meron Hospice, go there to finish the last end of your life, right? And Dr. Ami was actually sharing with me that's not the way to look at palliative care. It's actually to look at palliative care as giving life, making life meaningful, enjoyable. So I was there at palliative center, and I went to a day hospice, right? So it's no overnight patients for that one. And all the people there were in, not all, most of the people there were in terminal stage, and many of them cancer, and many of them elderly. And they were doing things like planting plants and playing mahjong. Oh, Doc, you're gonna love this. In a hospital, it's in a wing hospital, they have a bar. They have an alcohol bar. It's like, no way will you have a bar in a hospital, because you don't serve alcohol in a hospital. But at this hospice, they actually have a bar, and on Friday nights, they make alcoholic drinks in a hospital setting, because it's actually palliative care. So it's about life, right? So it's about life. So for this particular viewer who called in, Dr. Jansen gave the perfect answer. Ask what your mom wants. Ask what your mom wants. I'm not sure if I'm quite confident that the number one thing your mom wants is to feel comfortable. All right. So I think choose options that will help your mom feel comfortable. Now, if your mom wants to be able to be more energetic, I would advise Simply Nature Pipa liquid extract. So I will share one testimony, and I also let Doc share, because he has had many patients who are bedridden. This was actually a patient of my Lola, Dr. Angie. And this Dr. Angie, in her later years, was actually running a hospice, right? So this is really the place where people for end of life, right? And this hospice patient had her cancer that metastasized to the brain. And it was at a Catholic, like a Catholic parish, right? So the brother was actually the priest in that Catholic parish. And the sister flew in from UK. They had spent 6 million pesos on treatment, but in the end of the day, the cancer was just too aggressive. And her sister was lying in the hospice, and she was mostly unconscious most of the time. Okay, then Dr. Angie asked her to try Simply Nature Pipa liquid extract. So after, I think, 3-4 days, the patient actually became awake and stayed awake just in time for her sister, who is a nurse from the UK, flying back. They actually had conversations, completely awake. And I actually went to see the patient, and I actually thought she looked normal, that she looked healthy, right? She didn't walk around too much, but she was sitting on the bed, sitting upright. Her face was looking bright. She was alert. She was having conversations with me. There is strength in her voice. And then 1 week later, she slept, and she just returned to the Lord from there. So that whole scenario just struck me really hard, that if you want, what Simply Nature Pipa liquid, even in the most difficult situations, can do is allow the families, hopefully, if we can strengthen the patient, allow the family to have a few more great memories. So imagine the sister flew all the way from the UK. It was her younger sister that was the one that had cancer. She was able to speak to her, sit by her bed. They actually had conversations instead of her looking at her sister comatose, right? So I think I want to encourage you to ask what does your mom want, and try to make her feel comfortable. Is there anything she wants to do, anybody she wants to meet? Then try to make those things that she wants quality, right? Memorable, so that you have wonderful memories from her start of her life all the way till she returns to the Lord. Yeah. Doc, what about yourself?
Yeah, nothing to add already. I think, yeah.
Yeah, this is
That's
a
what you do
difficult.
in that
Yeah, that's
kind
what
of
you do.
situation.
Create memories, right?
Hmm.
Yeah, create memories. Okay. So
Thank
yeah,
you.
I would recommend if you can, liquid. I think because it's the one for bedridden people, patients, is the one that you can see the most strength. Yeah.
Thank you. Still quite an honest and very heartfelt answer from our experts. Thank you. We're off to a good start for tonight. Okay, for our next question coming from Ms. Jamie Cheng Lao. Question is, do you have recommendation for fatty liver and insulin resistance?
A very common issue. Fatty liver and insulin resistance go hand in hand.
Yeah.
The reason why you have insulin resistance is because of the fatty liver.
So, Doc, there's a misconception. People think it's sugar that causes diabetes. Oh,
No, not really. It's a symptom. It's a symptom.
so the thing
So
that really
either you have,
Mm.
yeah, it's fat.
It's fat. Guys, it's fat, huh? Surprisingly, it's not your carbohydrates. Yeah.
Uh-huh. Mm. Yeah. So our blood, so glucose. The blood is where it's where usually glucose resides, no? So that's sort of like the transitory area of glucose. So glucose comes in by food, by way of your intestines. Glucose goes out by way of your organs because your organs utilizes the glucose. So insulin is like a key or a taxi or a car or a vehicle that facilitates the movement of glucose. So if you have lack of vehicles, a lack of transportation, then guess what? You will have a traffic jam or you will have high glucose, you will have high blood glucose, no? Because you have to keep on eating, right? Now, if there are things that's blocking the movement of the vehicles, say for example, there was an accident, quote unquote accident, which I would call intramyocellular fats, or if you have fats inside your liver or fats um surrounding your pancreas, then guess what? The movement of insulin would also be impeded. Hence, the movement of the passengers, which is glucose, would also be hindered. Okay, that's why you have elevated blood glucose, which is a symptom of an underlying issue or an underlying problem, which is fat toxicity, really fat toxicity. Okay? So yeah, recommendations for fatty liver: eat a high fiber diet, exercise, lessen your processed carbohydrate intake. That's what you do basically. Okay, keep a healthy weight.
Excellent. Thank you, Doc. Okay, so in terms of PPARs, Doc, would you recommend, since this is quite multiple, would you recommend
Yeah,
still the
of
soft
course.
gel capsule or the powder?
I will recommend just the soft gel. The soft gel would be enough. The powder I think is too expensive for this one, for
Yeah.
this kind of problem. But if you have no issues with finances, then you go for the liquid, of course.
Yeah.
But for this one, just the soft gel, I would use that, but I would not rely 100% only on the soft gel. Okay, you might still need medications. The soft gel's role then would just be to improve the efficacy of the medications. Yeah. Okay, but I would still include it, especially if you have high triglyceride levels, then, or if you have high triglyceride levels and if you have high inflammatory markers, then yeah, all the more that PPARs would be a good thing to add in your stack, supplement and medication stack.
Yeah. Stack. I like it. Yeah.
Thank you, Doc. Thank you, Doc. Thank you, Sir Sean. Okay, for our next question. Actually, our topic today is, of course, related to breast cancer, and two people here are asking. First up, let's go to the question of Ms. Rosita. Your question is, what is your best recommendation for breast cancer? So while the other one, Miss Agnes, is asking just your recommendation for breast cyst. So it's both breast related.
Both breast related. Okay. For the breast cyst, let's answer the easier question first. For breast cyst, if it's increasing in size, if it's causing pain, then you remove it surgically. That's the most efficient and the cheapest way to approach it. Okay. For breast cancer, then we have to do proper diagnostics. We have to know the enemy for us to defeat the enemy. Okay? So do the proper diagnostics, do biopsy, make sure proper characterization is done. Know if it's estrogen receptor, progesterone receptor, or HER2 positive. Then go for the necessary treatments. Okay? If you want to do more tests, okay, I would recommend liquid biopsy, RGCC's Onconomics Plus, because RGCC's Onconomics Plus will show you the exact medication and supplements that will kill the cancer cells. So that's a very advanced testing which costs a lot as well. So but it does a lot of help, especially when it comes to the treatment options, treatment choice. Okay. Yeah, so that's how I would approach breast cancer. If you can remove the tumor, all the better. That if you can remove it, because cancer is always easier to treat if the headquarters of the cancer is not there in your body. Tumor burden substantially goes down. Survival rate goes up dramatically. But again, you have to follow it up. It doesn't mean that you underwent surgery, immediately the survival rate improves. Because if you do the surgery and you don't follow it up with the necessary follow-up treatments, then the improvement in survival doesn't mean anything. Because
Sayang.
eventually, because eventually, over time, your risk of getting recurrence or getting metastatic disease will just go up. So you have to strike when the iron is hot. Strike when tumor burden is low. Strike when there's no evidence of disease. Make sure there are no circulating tumor cells remaining. Okay.
Doc, I have a follow-up question for you. I mean, this one is going to be your personal opinion. Is this so for today, when a person gets breast cancer, what in your mind, right? What is in the past, it would just be a mastectomy, a total mastectomy, and then chemotherapies, right? Today, based on your experience, what would be the perfect approach in your mind today, and from your experience to a person going in to fight breast cancer? So let's just take a simple one. Let's say someone in stage 3, which means the cancer is already spreading. Or maybe stage 2. So 2 cases, stage 2 and stage 3, because I think one surgery is a better option for one than the other. So can you share with us so that the viewer who asked this, right, may see right now today, from your expert medical perspective, what is the perfect approach towards treating breast cancer?
Okay, this is how I will do it. So let's assume that the diagnosis has been established, staging has been established.
Okay.
Now we are trying to determine treatment options. First, if the tumor is sufficiently small and if surgery is still possible, first step is surgery.
Okay.
First step.
That is always surgery.
Remove the
Fastest,
tumor
most complete.
outright.
Yeah.
Most
And
efficient one as well. Okay.
Just want to ask you today, because in the past, when we said surgery, it means cut off the whole breast. Now, today, is cutting off the whole breast always the best option? Is it even the best option anymore? Or are there different approaches today?
It depends on the staging. So if the stage is stage 1, then lumpectomy plus radiation therapy is equivalent to mastectomy.
Oh, so it's just as good. So that means you don't have to cut off your whole breast. It's just as effective. So it depends on your staging, everyone. Okay, so straight away when Dr. Jansen says in principle, first step is surgery, it does not necessarily mean complete mastectomy, right? So depending on your case, just partial removal is just as good. Okay, so keep your options open. Check for your specific case. Yeah, Doc, next step.
So next one would be, okay, once the tumor has been removed, then I will now check the RGCC panel, the onconomics panel. So I want to know among the medications and drugs and natural extracts that's available to me, I want to know specifically what will kill the circulating tumor cells. So I do not waste money on things that does not work or it doesn't even kill the cancer cells. Okay. So when I get the panels, I go on it, monitor the circulating tumor cells, monitor imaging. Okay. So again, I'll repeat. So go for surgery, tumor gone. Now what's remaining is circulating tumor cells. Next step would be to do a liquid biopsy, specifically the RGCC Onconomics Plus. get the blood, isolate the circulating tumor cells, identify drugs and natural extracts. Once you have the drug and natural extract panel, you combine. Okay, so for this combination, what doctors would you need? You need a medical oncologist and an integrative medicine practitioner, integrative oncology practitioner. Okay, to
Like
get
yourself. Like
yeah,
yourself.
like myself. So I handle the natural extracts part. The drugs part, the medical oncologist handles that. So you mix. So once you have that plan, you monitor. What do you monitor? Imaging. Okay? If there are still known nodules, or if there are still known tumors in the body that was not taken out by surgery, then you monitor that through imaging. Imaging would be enough at this point. But if the PET CT scan, no, if the PET CT scan says no evidence of disease, in other words, there's no lesion in your body, clean, bones, lungs, brain, liver, all clean, then what do you monitor? You monitor the circulating tumor cells, the cancer cells swimming in your blood. What test do you go for? That would be RGCCs, OncoCount or OncoTrace, OncoTrail or OncoTrace. Okay, so that's what you monitor. So how often do you monitor? You can monitor once every 3 to 6 months. Okay, so what you want to see there is the circulating tumor cells going down. Ideally, you want it to go to 0. Okay, so you monitor. Now, how do you know if the current protocol is working or not? If, for me, if the circulating tumor cells is stagnant, it's not moving for at least a year, then I will consider supportive oligonucleotide therapy. I think this is something new that I shared with you guys. Supportive oligonucleotide therapy is essentially a technology wherein we develop an antidote to the poison. So what's the poison? The poison is the main gene that's driving cancer growth. So the sample that we need for this is the circulating tumor cells. So we get the cancer cells, identify the gene that's mainly driving the cancer growth or the persistence of cancer. So that gene, we develop an antisense RNA. Okay, for those of you who are watching us who are highly technical people, antisense RNA. So that's like your quote unquote antidote. Okay, so that antidote we develop for the poison, then that antidote we give to you. So that's essentially going to eradicate all cancer cells that has that gene. Okay, so how often do you need this SOT, or supportive oligonucleotide therapy? You need this once every quarter. Yeah. So
how much is that, Doc? Just I'm curious also. How much is
okay,
that?
SRP is 138,000 for you to develop that one
Okay.
dose.
Okay.
But there's a but, okay? There are additional costs to this. For that supportive oligonucleotide therapy to be effective, you need the latest circulating tumor cells, the latest population. So you have to
spend on
undergo
your diagnostics as
yeah,
well.
you have to undergo the OncoCount. OncoCount is 60,000 pesos. So 60,000 plus 138 would cost you around 199. So 200,000
Oh wow.
per
Okay,
request of test and per when you give it. So this goes on every quarter.
Okay.
At least every quarter. So you repeat that process until you get 0 circulating tumor cells. Once you get 0 circulating tumor cells, you don't end there. You need at least 3 tests that shows you 0 circulating tumor cells. Then we can declare now you being cancer free.
All right. So
Yeah.
can I summarize Doc Jansen's into like a 3-part thing? Okay, number 1, all right, go for surgery, right? And you'll be surprised. Surgery may not mean that thing that you are so afraid of, cutting off the whole breast, all right? So that a partial removal is as good as a full removal, depending on your staging and on your specific case. Okay, but at least you can go in without like your worst nightmare thinking about that. Okay, so that's number one. So surgery, after surgery, you have your treatments. Okay, so Doc Jansen already shared both the medical and also the integrative. And both sides are actually full medical doctors are helping you, but they are specialists in different areas. Okay. So the whole idea is you're going for the treatment, but you have also have got to strengthen your body, support your body through the treatment, minimizing the damage any treatment that you're choosing will have. Right. This will also lower your chances of recurrence. And the last stage that Dr. Jansen says is you must have a after treatment program. It's not over. It's not over yet, right? Your aggressive treatment is not over. Your aggressive treatment is over, but the next stage seems very peaceful, but it's actually just as dangerous because if you're not careful here, recurrence will happen. So you have to be vigilant. So Dr. Jansen has shared a diagnostic tool that can help you check even better than the scans because it's specifically for circulating cancer cells. And then there are regimes to boost and strengthen your body so that it stays anti-cancer during this period. So there is a immediate thing that you can do, the standard aggressive treatment that you can do, and then after that it doesn't end, right? That's where your onco ends because normally your onco doesn't have any drugs to give you anymore. So it will be doctors like Dr. Jansen who will then continue to watch what's the circulating cancer count and prescribe to you protocols to help you stay strong and cancer-free after your aggressive treatment. All right, I hope that's helpful. Okay, so now you can see it's a more complete thing. Last time is very simple, just chemotherapy, surgery, radiation. All right, but now there is a lot more you can do. All right, especially to prevent or reduce the chances of recurrence. Yeah.
Thank you. It's all good news that you've shared tonight. Thank you, Sir Sean. Thank you, Doc Jansen. And of course, for those of you who wish to have a consult with Doc Jansen, simply type in how to consult. Our caring HCS, Miss Beth and Miss Irish will get in touch with you individually. All right, just before we go to our next question, I'd like to greet, of course, our avid viewer, Miss Helen Kamanayan from Baguio, and of course, Mr. Ronil Osorio. Thank you for watching us tonight. Okay, for our next question, on a lighter note, let's go to these two questions related to Cleansing Plus. So the questions are, what is the best time to take Cleansing Plus and how long should we take this?
Okay, this one simple. So Cleansing Plus, take it in the evening normally, like 1 hour before you sleep, right? And do time it. You will expect to go to the CR about 8 hours, right? So anywhere between 7 to 9 hours, that is the timing. So don't take it when you know tomorrow during this time you will be in the middle of Philippine Metro Manila traffic. You would be very uncomfortable, all right? And you will be searching for the nearest petrol station so that you can find the CR. So this is the important thing to take note. It will be about anywhere between 7 to 9 hours. You will have a strong urge to go. If it's the first time you're taking Cleansing Plus, you might even go 2 times. But that's a good thing, right? It's just these things coming out. So normally we will recommend you to take it on a weekend, or if you know you're gonna be free or working from home the next day, right? If you work from home the next day, then yeah, take it. Anytime after your dinner. Now, there are cases that people who, for example, know they're waking. There are people who take it in the morning, all right, and then so that they go and poop during the afternoon. So again, depending on your schedules and your need, but it's safe to take every day. But once you're regular, you don't really have to. I take Cleansing Plus, or my wife makes me take Cleansing Plus, okay, once a week. So usually I'll take it on Sunday night. Why? Because on Monday mornings I have my Zoom meetings with my company. So I'm not going out on Monday until late afternoon. So I usually take my Cleansing Plus once a week on a Sunday night. So take it usually in the evening after food, and you time it with the 8-hour release pattern. Okay. And remember, after you drink your Cleansing Plus, right? No, you mix it with 1 glass of water. Please take another glass of water. You can sip slowly. You don't have to gulp, okay? Why? Because it's important. When you take fiber, you need to take enough water. It will improve the efficacy and it will prevent you from feeling clogged up. Okay. Yeah. So it's very important to take sufficient water. So 2 cups of water, the one with the original, with the cleansing plus, and another one after.
Thank you, Sir Sean. Sir, Dr. Jansen, would you like to add anything?
Not anymore. I mean, yeah, cleansing plus fiber, well, it's fiber.
Yeah.
So a lot of applications,
Yeah,
weight loss,
lots of
constitution,
application.
cholesterol lowering. That's
Yeah.
also effective for cholesterol lowering. Yeah,
Even
Just-
immune system. I learned from you, even immune system, because
system,
if you
that's
get
right.
your gut healthy, your immune system improves.
right. So a lot of applications. So just a reminder, if you're taking other things aside from cleansing plus, just space them out. Don't take them at the same time. How would I do it? How would I do it? Keep them an hour apart, at least an hour apart, so you can take either you can take your medications first or you can take cleansing plus first. So tip. Say for example, you're taking medications and some supplements need food for you to be able to absorb.
Oh,
So,
yes.
and if you want fiber, here's how I would time it. Drink fiber first, an hour before you eat your meal. So say for example, you eat your dinner at 7. Drink your cleansing plus at 6 p.m. Then 7, you eat your dinner, take in the supplements, the necessary supplements, then you'll be fine. If you do it that way, most of the fiber would now be in your intestine. And you'll feel full. Still feel full. Even so, because fiber is, it's really what do you call that? What term do you say about it makes you feel full easier.
Yeah,
So
satiated.
just space them out.
Makes
Yeah,
you
satiated.
satiated.
So the spacing will make sure that you absorb the supplements and the medications that you're taking. Yeah.
Thank you, Dr. Jansen. Thank you, Sir Sean. And I think I'd like to say that one more quite evident in terms of the effects of our cleansing plus is of course the skin health. I think with the both, most especially with both Sir Sean and Dr. Jansen, you can see it very well.
You know, there's another one. Doc, I don't know if you've had patients with this experience. Those with migraines, people with chronic migraines, a lot of them are constipated. And if they come regular, their migraines also improve. It may not totally go away, but it does improve, you know. So any of you who are suffering from like chronic migraine, and you're also constipated, yeah, this is probably something you should try, right? Because most people don't think about it, you know. Another one that is surprising is when I used to speak to Dr. Alhambra, she's a neurologist, and she said for patients who are undergoing, it's really crazy, you know. I was just so surprised. She said if there's any patient who is any mental disorder, any brain disorder, so we are talking about depression, schizophrenia, split personality, manic depression, all this, her first question to them has got nothing to do with the brain. She will ask them, are you regular? And if they're not regular, on top of her treatment as a neurologist, she will ask them to take fiber so that they are more regular. So being regular will actually help your mood and also your brain functions. It's very helpful for brain disorders, all right? So there you go. Something probably you wouldn't know. Yeah.
Sir, yeah, because as you have mentioned it, I think one common condition that could help is also the kids with autism. Kids with autism, most of them are quite on the heavy side. So to manage their weight, cleansing plus would also be one of the best.
Okay. Interesting. Yeah.
All right. Thank you, Sir Sean. Thank you, Dr. Jansen. Okay, just before we go to the next question, I just want to say hello to our very regular viewer, Miss Noemi Veras. Thank you. Okay. All right. For next question, this is thrown to us privately by one of our viewers. The question is, my grandma is 75 years old with suspicious breast cancer stage 3 because it's 9 cm based on the ultrasound. with extensive lymph node. But after the surgery, but afraid of surgery and chemotherapy because she's very thin, only 36 kilos.
Wow, very thin.
Yes. We've been informed meat is carcinogenic, so what else can she eat? And because
Oh, wow.
she has tried Ensure plant-based, but it incurred itchiness afterwards.
Oh,
Also,
wow.
just a follow-up comment, she also is already taking PPARS powder, 2 scoops 3 times a day, so total of 6 per day. What
Okay.
other treatments can we explore?
Yeah. Wow, wonderful.
Okay, here's how I would do it. Since she's only 36 kilos,
Yeah.
she's highly at risk of malnutrition. Okay? So you have to either maintain status quo or help increase her weight. So number one, I would shift PPARS powder to PPARS liquid.
Mm.
If PPARS liquid is not viable, then I would add fish oil. Okay? Um, yeah, if in case PPARS powder is too expensive as well, I would go for the soft gel. But as the soft gel has to be taken 3 times a day. Okay? The reason is the omega-3 fatty acids. The extracts, no, especially liquid and soft gel, are rich in omega-3 fatty acids, algal fatty acids, no. These are the PPAR agonists. So these are very important to help lower inflammation, which will help the muscle which will help the muscle to maintain its size. Okay, and this is also to help the liver produce more protein, to produce more albumin for the muscles to use to help them grow. Okay. Uh, Number two, protein source. So you're correct that meat is carcinogenic. So I would encourage her to eat fish and eggs instead. Poultry, yes, you need it. She needs it. So that's how I would arrange the dietary program. Then of course, the plant foods are a given already. So she has to eat as much plant foods as she can. Eat fish, eggs every single day. Now, the problem with fish and eggs now would be the glutamine, because glutamine is richly found in animal protein. So now you have a dilemma. Okay? Do you go on a vegetarian diet to give her a low glutamine diet, or you allow her to suffer from malnutrition by underweight? Okay? There are ways on how you can block glutamine uptake of cancer cells. This is when you use repurposed drugs and certain natural extracts. I'll give you examples. No, metformin is one. Mebendazole is another. You also have berberine. Berberine is also one that can inhibit glutamine uptake. So these are some. Okay. Yeah, that's how I would do it for this patient. But ultimately, the 9 centimeter tumor, it has to come down. How do you reduce that? Chemotherapy. I don't think I don't think surgeons would be confident enough to tell you that, okay, let's just remove the 9 centimeter tumor, especially with very extensive lymph nodes. Chemotherapy would always be on top of the list for this case. Yeah, so that's what you can do. But of course, this is just educational for me
So
to
please,
really.
yeah, this is not a consultation, huh? Please be careful. And if you want, and these are the cases where it's very clear that if you go for chemotherapy, an elderly, for example, is go for the liquid if you're gonna go for chemotherapy, because we know an elderly undergoing chemotherapy, there are the risks. Then all the more you need the protection as well. But if you don't do anything for an elderly, then your strategy or your mindset may be quality of life instead of merely not just beating the cancer. So this is a very tough decision, but it's one that if you talk to the patient and if you are focused on the happiness of the patient, if you are focused on the life of the patient, like if the patient lived a great life, then actually the whole process will become clearer, for you and your family.
Thank you. Dr. Jansen, I'm just very, very curious because you mentioned earlier for such condition, it's quite still necessary for the patient to eat fish and eggs.
Yeah. So this is very interesting, right? We have in the past, doc, right? We always have some like laws that when we share, our viewers think, when they watch YouTube, when they see TikTok, when people give like seemingly laws. Don't eat any meat. It's carcinogenic. But Dr. Johnson, if you see a patient that looks like me going for who's right in the same condition, that means cancer, I think you will very confidently tell me and very fiercely tell me, stop eating meat, just go for plant-based. Right? Because I look okay. I'm not super thin. So you will notice Dr. Johnson introduced this because the patient is 36 kilos. It's really very light and very thin. Even not seeing the person on video, just knowing the weight. So you see, there are things. Don't try to self-medicate and don't just believe what you see on YouTube or the so-called conventional wisdom. Dr. Johnson always likes to say this, and I agree with him. Every person is a specific, unique case. All right, so you need to talk to people, doctors and health practitioners that will look at you uniquely. You're not just it's not just a hard and fast rule, because every rule has many parameters. You do this if this. So for this particular patient, 36 kilo, even fish is not ideal for a cancer patient, but the 36 kilo is more dangerous than the fish. Right, so this is why we would say if fish help the patient put on weight, then go ahead. Yeah.
So, Doc, I suppose when it comes to the necessary, since it's necessary for them to take this, as long as it's not fried, and for the egg, it should be boiled. Can we safely say that it?
Yeah, I think at this point you prepare it in the best possible way that you can. So steam and keep it simple would be good. Yeah.
Thank you, sir. Thank you, Doc. Okay, for our next question, by the way, for those of you who wish to have a consult with Dr. Jansen, he can actually simply share even some recipes. See him how he does his consultations. It's so fun, I must say. So yeah, do comment down how to consult. Miss Beth and Miss Irish will message you right away. Thank you. Okay, for our next question coming from Mr. Jake, thrown to us privately. Question is it still is liver cirrhosis still curable?
Depending
Yep.
the only way you cure liver cirrhosis is by replacing the liver. Liver transplant. Okay. Because once liver cirrhosis is a state, okay, I'll translate liver cirrhosis into layman's term. Liver cirrhosis is scarred liver. If there's a scar on your liver, the scar or scab will remain a scab. A scab will not go back to what it was before already. So, yeah, irreversible state already if you are in liver cirrhosis. Yeah, so you cannot replace that part of the liver which is already cirrhotic. Even if you use stem cells, there's no way going about it.
I just have a question just out of nowhere in my mind, right? If the part of your liver that is that has undergone cirrhosis, what if you just cut that part out? Because the liver is highly regenerative. Will it allow you to regrow the liver? It just came to my mind.
No.
Okay, it won't, is it?
Because because when you go into liver cirrhosis, you have to remember the environment in which the liver is in for it to go into cirrhosis. So, how do you go into liver cirrhosis? One, you either got a chronic hepatitis infection, hepatitis C or B,
Okay.
or you took some medication that rendered your liver to go into cirrhosis, or
Oh,
number three, you have fatty liver disease that was not treated. In all three cases, the entire liver would be hit.
okay. So there's not like one part, right? Okay. All right. Now, guys,
Yeah.
why I ask this question is you'll be amazed how regenerative your liver is. You can cut half of it away and it would actually grow back. It's almost like Wolverine in your body. All right. So yeah. So do take care of your liver. Your liver has the ability to heal itself if you don't damage it to that extent, right?
Doc, is it possible for kids to have this? Or, kasi
To
you
have
know,
liver cirrhosis?
No.
yeah.
I don't think so. I don't think so. Liver cirrhosis in children,
Mhm.
No.
if it exists, it
Drug induced?
is really, really, really rare. It's extremely rare.
Yeah.
Yeah, I haven't heard of this. I mean, let me see, just for academic.
Yeah, that's a big.
Is there a case of
Because
trying to Google right now?
you mentioned the causes could be because of the medication.
Cirrhosis.
Yeah,
Ayun.
because before, as far as we know, these are the people who loves to drink alcohol. So
So obviously your kids shouldn't be drinking alcohol.
they shouldn't.
Yeah. It says here,
Uh-huh.
you have, yes, it can happen, liver cirrhosis in the pediatric age group, but the key causes includes biliary atresia, autoimmune hepatitis, and Wilson's disease,
Okay.
all of which are extremely rare. Biliary atresia is a congenital disease wherein the biliary tree does not form. So, your okay, so the biliary tree transports the bile that the liver produces into the gallbladder and into your intestine, into your small intestine. So this conduit, the biliary tree, is not existing. Children who have biliary atresia rarely go beyond 2 years old. You need surgery, and even if you do surgery, the prognosis is not good. You would only extend the life of the child for a few months, a year or two perhaps. For autoimmune hepatitis, this is where the immune system of the patient is attacking the liver. So that in which case, then yeah, you can develop liver cirrhosis. But for autoimmune hepatitis, this can be treated, but it's very, very difficult because you have to be on long-term steroids if you have autoimmune hepatitis to suppress the immune system. And if you suppress the immune system for long periods of time, then guess what? You would probably die of some sort of infection. Another thing, if you do not die of infection, then you will die of metabolic issues because of long-term steroid use. One would be diabetes, obesity, osteoporosis. Those are just some. There are a lot of there are others. Wilson's disease. Wilson's disease is a syndrome. So Wilson's disease is also something like congenital, but this disease mainly causes an unusual or extremely high buildup of copper in the liver, brain, and eyes. So this is a genetic defect. And with Wilson's disease, the prognosis is also not quite good, but you can live with this. How do you live with this? Can you extend a life of a patient who has Wilson's disease? By chelating copper. You remove copper. And you can also use zinc therapy because zinc and copper are opposite. These two counteract each other. So you can extend the life of a patient with Wilson's disease by doing chelation therapy and supplementing with zinc. But going back to the question of Sheila, can liver cirrhosis exist in the pediatric population? Yes, definitely. Yeah, it can, but it's extremely rare. It's extremely rare.
And it's not lifestyle created. It's not lifestyle created. It's really like
It's usually genetic
it's
or
really
congenital.
genetic.
Yeah,
All right.
correct.
So it's not something that you can just reverse like that, right? Yeah, there is actually a genetic issue or serious illness. Yeah.
Thank you, Doc. Thank you, Sir Sean. Okay, I guess this would be our last question for today.
Yep.
Okay, also thrown actually yesterday during our SNA. And question is coming from Mr. Credo. Question is CKD stage 5 reversible? I've seen some testimonials that they are healed.
No, I actually answered
I
this.
don't know with the stories you've heard.
No,
Yeah.
I answered this yesterday. Maybe you can elaborate. I said only if you move from, let's say, 3 to 5 because of an acute kidney injury.
Yes, that's correct.
Yeah. So your 5 is actually a temporary. It's not a chronic developed 5, which is very difficult. Yeah, almost
Yeah.
impossible.
And you're also correct in that sense because it depends on the degree of injury. Now, if we go back to the question, if the question is, can a person go from normal kidney function, go into kidney failure, then go back to normal kidney function again? That one, the answer is a straightforward no. Okay? But if it's an acute kidney injury, then say for example, from you have already an existing kidney problem. So say for example, you're CKD stage 3. Then you suddenly had a kidney injury. Then you go to stage 5.
Yeah.
Then if it's acute, if it's immediately treated, then there's a possibility
Yeah.
that you can get out of stage 5.
Yeah.
Okay? So this is upstaging. Upstaging or downstaging. Yeah, I should say downstaging. But definitely not go back to the normal kidney function. Okay, so probably from 3, you had a kidney injury, acute kidney injury, you go to 5. Doctors treat it. You were able to recover. Probably not 5. You go down to 4.
Yeah.
Then go down to 4. Hopefully, you go back to 3.
To 3.
So that's about it. That's about it. Yeah.
Very positive. Thank you. Thank you, Sir Sean. Thank you, Doc Jansen. Okay, well, we're almost at the end of the webinar. As we wrap up this evening, I want to hear your, of course, not only mine, but of course, our viewers would like to hear your final thoughts for our viewers. And as you know, we are celebrating. We are in the heart of this March month. We are celebrating our International Women's Month. So yeah, would like to start first. Maybe Dr. Anson.
Yeah, I'll go first. Everybody, thank you for attending, no? And I know that this is a very difficult time in our lives right now because of the war. Everything is going up in price. The only good thing that I think that's happening is, traffic in Metro Manila suddenly got better.
Oh, really? Okay, because it's expensive now.
Yeah, it's expensive now. So EDSA in rush hour,
It's more
vehicles are
manageable.
running 40 kilometers per hour. So
Slower.
well, so I hope and I pray that the Middle East conflict gets resolved the soonest possible time, so everybody can go back to our normal lives, normal routine.
Yeah.
For cancer patients, for any other patient, it's always going to be a little bit more difficult, no? Stay resilient, everyone. If you need anything about your cases, conditions, questions, you can always reach out to us for consult. My online consult schedule is still open. Although they're getting kind of full every now and then.
Yeah.
But just reach out to us, and then we're going to be here to answer your questions and try to help you, with with no matter how difficult or challenging the current times may be. So good night, everybody, and again, I would like to thank you for attending tonight's webinar and for listening. I'll give the floor back to Sir Shan. Good night.
Thank you, Dr. Jansen. I just want to reiterate what Dr. Jansen said. First of all, thank you everyone for joining us. And costs are going up. So to everyone with a medical condition, this is what I would encourage you to do. Take action today, right? Because For example, if you have a pain or a lump or anything, and you are afraid to go and check it out because let's just wait a little bit more. My advice to you is don't wait. Why? Because this conflict in the Middle East, right, is not going to be solved anytime soon. Okay, so here in Asia, in Singapore and Philippines, the good news is that there's not going to be any bullets or bombs coming our way. But one thing will happen is for Singapore, for Middle East, as well for Philippines, most of our oil is coming from the Hamas Straits, right? So that is going to not be resolved anytime soon. And the moment the reserves, that means the spare petrol that every one of our government is keeping but releasing now, it will run out. Once it runs out, then all these petrol prices will go up. Then even everything from your rent, from your Ansaimada to your Biko to even your Turon and everything, the price will go up, right? So it's better to seek medical treatment now. So for example, the X-ray that you do now is going to be cheaper than the X-ray that you do 6 months from now, if and most likely the war is not going to be resolved. Don't forget, the Ukraine war is still going on, and that's been, what, 4 years, something like that already, right? So we don't see this crisis ending anytime soon. Like I said, it won't affect us with bombs and bullets, but it will affect us in terms of cost here in Asia. Okay, so if you have any medical issues, any concerns, you have a pain here and there, go and see your doctor now. Don't worry about it being expensive today, because it'll be worse if you really have a problem and then you seek treatment 6 months from now. It's really going to be more difficult, more expensive. All right, so treat it now. Yeah. With that, I still wish you all a great week ahead. And it's a public holiday tomorrow in Singapore. Is it the same for?
Yes.
Okay, yes. All right, it's Hari Raya, right? Yeah, it's the Malay New Year.
It's Idil Fitr here in the Philippines.
Okay, yeah, it's Hari Raya here in Singapore. I think it's the same thing, different name. Okay, yeah, but it's in Singapore it's a Muslim holiday, but of course it's a national holiday. So wishing everyone a great long weekend ahead, and wishing you all the best. Like what we say here in Simply Nature, we're here with you from start to healing. So we're here to support you. All right, so goodbye, everybody. See you guys next week.
Thank you, Sir Sean.
And the time back to Sheila.
Thank you so much, Sir Sean. Okay, well, once again, thank you for your questions, and thank you for considering our program of value while you journey with your own health battles. And on behalf of our patients and viewers, thank you so much, Dr. Jansen and Sir Shyan Lim, for towards all our questions tonight. Now, please stay tuned because I have a lot of exciting announcements to share with you all, because exclusive for website orders only. Yes, you can still buy your PPARS liquid extract and PPARS powder extract with no shipping fees. So whether you're ordering from Metro Manila or anywhere nationwide, you can avail of this free shipping promo. Once again, this is only available via website. That's www.simplynature.ph. Next one, of course, we just want to inform you that if you buy PPARS powder extract or PPARS liquid extract, you can automatically get a free AD Pro serum. What's this? This is like giving you both internal cellular support and external skin nourishment in one powerful promo. So yes, this means if you buy your PPARS extract like powder and liquid via website, not only that you are getting the free AD Pro serum, you're actually buying them free on a free shipping promo as well. Okay, so that's for the liquid and the jar or the powder extract. Because if you are on a tight budget, that's okay. Because if you buy the tri-pack or tri-blisters of PPARS soft gel capsules, you are getting free Renew Mask. Wow. So these promos are available via direct and website. And that's www.simplynature.ph once again. So here's the thing. If you've been dealing with stubborn eczema, psoriasis, acne, and even recurring skin irritation, and nothing seems to work long-term, it's time to level up your skin game. Introducing AD Pro Biotic Serum. Designed to support your skin barrier, calm irritation, and help rebalance stressed out skin. And here's the best part. You can get this AD Pro Serum with free 1 unit of AD Pro. So this buy one, get one promo is still ongoing and are available on Shopee and Lazmall website and via direct options. Once again, this promo is limited time only, so please make sure to message your assigned client service officer now. Okay, I want to say hello to our VIPs out there. Please join us for an exclusive Simply Nature VIP meetup on April 29, 2026. That's a Wednesday at 7:30 p.m. via Zoom. Yes, this is not happening via Facebook Live here in our page. It's happening via Zoom. And this is featuring our Singapore's renowned PPARS expert, Mr. Shyan Lim. And beyond the expert knowledge, the evening promises plenty of excitement with exclusive raffle prizes. So please make sure to join us. And once again, this exclusive session is dedicated to our valued VIP community. So please expect a call from me, Sheila, Miss Jen, and of course, Miss Daisy. All right. And another exciting event. If cancer has touched your life, this is your next step because remission is not the finish line. The real work is building an internal environment that supports long-term stability. Join us for a live, in-person, face-to-face seminar featuring a powerhouse panel of cancer experts as we unpack the science of inflammation, metabolism, and sustained recovery. This event is entitled Beyond Remission, Building a Body That Sustains Recovery. Happening on May 30th, 2026. That's a Saturday at 8 a.m. to 11 a.m. at SMX Aura, BGC Taguig. So seats are limited and are running out. Okay, please secure your seats now. So talk to your assigned client service officer and healthcare specialist to secure your seats. Okay, and last but not the least, we're expanding our hours to better serve you. Elevate your weekend with a dedicated session of health and healing at our Saturday Dose of Wellness. This Saturday from 10 a.m. to 4 p.m., we invite you to our Simply Nature BGC office for an exclusive opportunity to receive expert wellness and advice directly from our resident pharmacist, Ms. Jan Macanjola. Whether you're looking to boost your immunity, understand cellular nutrition through PPARS, this is a chance to get professional guidance on a pharmacist's choice of Simply Nature PPARS products. But wait, there's more because when you purchase our flagship products on site at our BGC office on Saturday, particularly the PPARS liquid extract and the PPARS powder extract, you will receive free PPARS Plus tablet bottle. Yes, that is happening starting this Saturday to complete your health regimen. So guys, the freebie is actually worth 2,000 pesos. So please visit our office on Saturday. So be sure to reach out once again to your assigned CSO. All right, so we hope to see you next week for another episode of Simply Health Webinar. That's on March 26th, and that is once again, same day, same time, Thursday, 7:30 p.m. Thank you for spending your time with us. Once again, this is Simply Healed Webinar powered by Simply Nature International and Simply Healed Medical Group. And remember, your curiosity about your health conditions and victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.